Good evening. I'm psychiatrist Jay Fauver, live from Fort Wayne, Indiana. Welcome to Matters of the Mind. Now in its 27th year, Matters of the Mind is a live call-in program where you have the chance to choose the topic for discussion. So if you have any questions concerning mental health issues, give me a call in the Fort Wayne area by dialing 969-2720, or if you're calling any place else, coast to coast, you may dial 866-969-2720. Now on a fairly regular basis, we are broadcasting live every Monday night from our spectacular PBS Fort Wayne studios, which lie in the shadows of the Purdue Fort Wayne campus. And if you'd like to contact me with an email question that I can answer on the air, you may write me via the internet at Matters of the Mind, all one word, at WFWA.org. That's Matters of the Mind at WFWA.org. And I'll start tonight's program with an email I recently received. It reads, Dear Dr. Fauver, is there a better time of day to take vitamins and supplements with medications for that matter? Is it better to take them all at once or separate them throughout the day? I take my vitamin supplements and Lexapro, also known as escitalopram, 10 milligrams all together in the evening. Well, if you ask 5 physicians about taking medications with or without food at different times, you're going to get 5 different answers. So as a general rule, I would suggest that if you take a vitamin that is fat soluble, that is vitamin A, D, E, and K, fat soluble vitamins, A, D, E, and K, preferably take them with food. I'll be the first to admit, and I always tell my patients, and I don't tell them to do anything I don't do, or I don't tell them to not do something that I do, but I take vitamin D myself, and I don't usually take it with food. So ideally, you theoretically want to take it with food. Now, can I determine definitively that taking it on an empty stomach versus food makes that much of a difference? No. But theoretically, since they're fat soluble, they get into fat, they get absorbed there, they get possibly better absorbed. That's when you want to take them with food. Now, there are certain medications that you certainly want to take on an empty stomach. And there are certain medications you will certainly want to take with food. Lexapro is not one of them. Lexapro you can take on an empty stomach, and you might think, well, wait a minute, my doctor told me to take it with food initially. You take Lexapro when you first start taking it with food because, well, 90% of your body's serotonin is in the gut. Lexapro is increasing serotonin transmission, and if you take Lexapro on an empty stomach, initially it'll make you more nauseated and possibly give you more diarrhea. So we recommend that people take Lexapro with food initially to decrease the nausea and the possibility of diarrhea, but generally it gets absorbed just fine on its own. You can take it with vitamins and with supplements typically, but you want to talk it over with your clinician concerning which supplements you might be taking. For instance, CBD, which is a common supplement for many people, it will interact with many different medications. So you don't want to be taking CBD if you're taking various medications that are out there. There are medications like levothyroxine, also known as T4. Levothyroxine needs to be taken at least an hour before or 2 hours after you've eaten. In other words, levothyroxine does not get absorbed well if you have any food or any other medications in your stomach. It's very antisocial in that regard. It doesn't like to be around other medications or other food for absorption. So levothyroxine needs to be taken on a totally empty stomach. There are other medications like Geodon, also known as ziprasidone, for instance, that have to be taken with food to get absorption. So if you have a medication that you're taking and you're told to take it with food for absorption, you need to ongoingly take it with food. But if you're taking a medication with food initially, mainly to prevent the nausea, then perhaps later on you wouldn't need to do so. Hope that helps. Thanks for your email. Let's go to our first caller. Hello, Derek. Welcome to Matters of the Mind. Derek, you had a question about Benadryl, also known as diphenhydramine. You wonder about it being linked to dementia in the news. Is that only if you abuse it, if you take it? Diphenhydramine, or Benadryl, Derek, is a medication that has a strong antihistamine component, and it also has a so-called anticholinergic component. What that means, it blocks a particular chemical called acetylcholine. Acetylcholine is what you use in your brain to help you with your memory, and it's thought that one of the factors underlying Alzheimer's dementia is you have a decreased amount of acetylcholine. Acetylcholine comes from the front part of the brain called the nucleus of Meynert, and it gets sprayed out through the brain. Well, Benadryl, or diphenhydramine, will block acetylcholine, and in doing so, it will mimic the symptoms of dementia. And I remember 20 years ago hearing about studies where people would take diphenhydramine or Benadryl at bedtime as a sleeping aid, and it does help with sleep, but if they did driving studies on them, up to noon the next day they were impaired in their driving. So we often recommend that people don't take diphenhydramine or Benadryl at bedtime as a sleeping aid. There are better alternatives, even over the counter. I would certainly suggest doxylamine, also known as Unisom, as a prescription medication. Hydroxyzine is another antihistamine. Does not have as much of an anticholinergic component to it. And we often use other medications like low-dose doxepin. We use gabapentin. We use trazodone. We use a lot of other medications for sleep that are not addicting and for which you do not become tolerant. In other words, you don't get used to them. But Benadryl or diphenhydramine wouldn't be a cause of dementia. It would just mimic the symptoms of dementia. So you could have memory disturbances and trouble with concentration even up to noon the next day if you're using it for sleep, especially if you're over 55 years of age. Now, we hear all the time about adolescents and even children taking Benadryl. Hey, they've got more resilient brains, so they can get by taking Benadryl at nighttime and they don't have as much trouble with memory and concentration. But if you're over about 55 years old, you probably don't want to take Benadryl as a sleeping aid because you can have trouble with memory often into the next day. Derek, thanks for your call. Let's go to our next caller. Hello, Paula. Welcome to Matters of Mind. Paula, you want to know why do your anxiety medications give you a racing pulse when you walk short distances? Paula, you're describing anxiety medications that are probably affecting serotonin. Now, serotonin is one of the big three neurotransmitters in the brain that affect anxiety and mood. There's serotonin, dopamine, and norepinephrine. Serotonin also comes from a little small area of the brain, and it comes from this area of the brain down here, kind of in the brainstem. So serotonin gets sprayed up into the cortical gray matter and comes from the raphe nucleus. And it's a chemical that will give your brain a calming effect, which is always nice. And sometimes if used in excessive amounts can make you feel like you don't even care. So we got to be careful with how much of a serotonin type of medication we give somebody. And if you take a higher dosage than what you really might need, it can give you a racing pulse. That's called serotonin toxicity. A racing pulse is among those type of symptoms, which also include nausea, diarrhea, headache, shakiness, and sometimes chills and even hot flashes for that matter. So if you're getting too much serotonin transmission going on there, even though you can be helpful for anxiety, that can give you difficulty with the racing pulse. And that indeed is part of serotonin toxicity. The type of medication is typically given for people who have trouble with anxiety that affects serotonin will be Effexor, also known as venlafaxine, Pristiq, known as desvenlafaxine, and then you have the serotonin reuptake inhibitors, such as, to use the trade names, Prozac, Paxil, Zoloft, Lexapro, and Celexa. So all those medications are affecting serotonin. Now, I might not have mentioned the one you were taking because you might be taking buspirone. Buspirone is very selective on which serotonin receptor it affects, but it still can give you a racing pulse. Buspirone basically will affect one of the 14 different serotonin receptors. It will basically fine-tune serotonin receptor that's called 1A. 1A serotonin receptors are fine-tuned by buspirone or Buspar, but even it can give you somewhat of a racing pulse. Well, how do you deal with that? Well, you ask your clinician if you could maybe lower the dosage or look for other alternatives, because that can be really annoying if you're walking and you're having a racing pulse, and especially if it's giving you difficulty with a racing if you're having trouble with the shortness of breath and you're breathing faster than usual. Thanks for your call. Let's go to our next caller. Hello, Adrian. Welcome to Matters of Mind.
Hi.
Good evening, Adrian.
Hi, yes. I am dealing with a racing pulse, shortness of breath. I'm dealing with high anxiety is what I'm going through. I've been, with my doctor as of recent as yesterday, offered some different medication to help me get through it. And I'm trying to figure out on my own, how do I deal with it on my own at this point? My heart rate is accelerating, and I'm trying to figure out how do I deal with it on my own.
Okay, well, I'm going to ask you the first question any psychiatrist is going to ask you, Adrian. When did it all start, and what might have caused it?
I've been dealing with it for too long, like over a year now, where my pulse is just accelerating through the roof. It's over 100 every time I go to my doctor's office. It's over 100. My heart rate is over quite a bit, and trying to figure out how do I deal with it and just bring it down on my own with hopefully some home remedies.
Yeah. Well, I'm wondering from a medical standpoint, why would you have a high pulse? A lot of different reasons. You could have high thyroid, you could have a cardiac arrhythmia where you have paroxysmal atrial tachycardia. Some women especially will have what's called postural orthostatic tachycardia syndrome. With the arrhythmia and with the POTS, or a postural orthostatic tachycardia syndrome, they will usually come and go. You're describing a fast heart rate that's kind of always there, correct?
Yes, and it's. I'm glad you mentioned that because I have been recently diagnosed with thyroid disease.
Low thyroid or high thyroid will be a factor there. So I've got good news for you. If it's related to the thyroid, that's treatable. Now, you want to get just the right amount of thyroid. If you get too much thyroid, yeah, that can give you a racing heart rate as well. But if you get too low a thyroid, I've seen people have high heart rate even with too low of thyroids. That could be the factor that would be the way that you could address that overall. Sure, you could do relaxation exercises. What people will often do is take a deep breath in over the course of 2 counts, blow out over the course of 4 counts. If you blow out when you exhale, that actually brings down your heart rate. Breathing in increases your heart rate a bit, so a little bit of an inhalation, maybe hold it for just 1 second, but if you can blow out and hold for a more extended period of time, that is a real simple technique that people will use to sometimes help themselves relax. And you don't want to hyperventilate. Hyperventilating would be where you breathe in, breathe out, breathe in, breathe out. And you might even be taking deep breaths, but sometimes you can blow off too much carbon dioxide that way, and that'll make you even more anxious and give you a higher heart rate. But a natural way, yeah, is just breathing exercises and different relaxation techniques that are available out there. But I'm thinking, Adrian, the first thing I'd want to do if I was you is get that thyroid addressed. If you have been diagnosed with thyroid disease right off the bat, that's a pretty easy fix. I've seen the same kind of phenomenon with other medical conditions, such as anemia, where people are low iron. I've seen people have, pulmonary embolism, where they get a fast heart rate and they're short of breath. So there's a lot of medical reasons out there, but it sounds like they've at least identified for you a thyroid disturbance that is treatable. And usually once you start getting treatment for your thyroid, they can improve the heart rate within a matter of 2 or 3 weeks. Now, there are medications that specifically will lower the heart rate, because if you have a high heart rate, Adrian, it makes you tired. I mean, physically and mentally tired because your heart's going so fast all the time. Okay, there are so-called beta blockers that will slow down the heart rate physically. Metoprolol is one of them. Propranolol is another one. But these are medications that will slow down the heart rate just from a medical standpoint. And for you, hopefully, it would just be a short-term fix.
Much because I do also suffer from low iron as well. So you just hit that right on the nail there. So
hey, I don't want to keep going, Adrian. We're clicking off too many things here. But okay, we got a thyroid disturbance that needs to be fixed. You got low iron needs to be fixed. Yes. Do you snore at nighttime by chance?
Yes, I do.
Are you treated for sleep apnea?
No, I have not been.
Okay, might want to get that checked out too. Sleep apnea is where you're not getting enough airflow into the lungs and thereby getting inadequate oxygen to the brain. And if you have sleep apnea, it's because you're snoring, or you might pause in your breathing at nighttime. You wouldn't know that, but other people sleeping with you would. They just notice you quit breathing every now and then. Sleep apnea is a very treatable condition, and if you have sleep apnea, you can be tired the next day. It's more likely that you're going to put on weight, especially around the belly. If you have sleep apnea, you have trouble with concentration. But I've seen sleep apnea also the next day cause people to have nausea, especially in the morning, and a fast heart rate. In other words, when you have sleep apnea, your brain gets the interpretation that you're smothering at nighttime, and you're getting these releases of cortisol, which is the stress hormone that will increase your heart rate and just make you anxious overall the next day. Adrian, you've got a whole bunch of reasons to get feeling better. So thanks for your call. Let's go to our next caller. Hello, Jason. Welcome to Matters of the Mind. Jason, you want to know, can you be born with anxiety? You can be hardwired for anxiety. And I ask this of patients I see all the time. Who in your family has similar symptoms? If you have anxiety, for instance, do you have a mother, father, brother, or sister with anxiety? Okay, we can be hardwired to some degree for anxiety. It's about 30% genetic. Now, here's what happens. Based on past life stressors, especially before the age of 8 years old, you're going to be more prone to having anxiety. If you had a lot of traumatic experiences, interacting with your parents, peers, friends, family members before you were 8 years of age. A lot of trauma before 8 years of age will give you a greater likelihood of having symptomatic anxiety and depression at later years. Does that mean you're automatically predestined to have anxiety? No, because if you learn coping strategies after 8 years of age, if you go through some things that you overcame, that can decrease the likelihood you're going to have anxiety. So you can be genetically wired for anxiety, but you've learned good coping strategies and you've endured some bad events in the past. Heck, it could make you a really good therapist for that matter later on because you can help other people. But yeah, to some degree, we're hardwired for anxiety. Our life experiences early on will flip the switch for anxiety because those switches won't even be flipped unless you had some traumatic experiences in a lot of cases. So environment does have a factor, but very importantly, your ability to cope through things and be able to endure and become resilient. That's a term we use a lot in our field, but resilience is basically where you're able to put up with stuff. In other words, stresses don't get to you as much as they might otherwise. So over the course of time, hopefully you can learn from these past experiences and actually be a help for others. Thanks for your call. Let's go to our next caller. Hello, Gary. Welcome to Matters of the Mind. Gary, you want to know, are there any warnings or negative side effects when trying hypnosis for the new year, and how does it work? Hypnosis is a true medical treatment. It needs to be done with careful supervision. It is only done if you're highly suggestible. In other words, Gary, hypnosis cannot be completed on people who don't want to be hypnotized. That's a big misconception. I know it's been discussed for 100 years now, hypnosis, and you can't hypnotize somebody just by looking at them or looking at somebody across a sidewalk or something. It doesn't work that way. You're basically the main person involved with hypnotizing yourself. As a matter of fact, the best means of hypnosis, if you're going to get hypnosis, make sure the hypnosis you're getting is the type where they teach you yourself, either by some kind of audio tapes or some means that they teach you yourself on how to do hypnosis, because hypnosis is not a one-time event. You do it again and again and again, and you practice it. So basically it's a state where you're not going into dissociation from the world around you. As a matter of fact, during hypnosis, your brain is very, very active. So it's very much like a dream state in your brain, but it's a state of high concentration, high focus. You're highly imaginative during that time, but you are in control of what happens around you. You might notice, for instance, if you're being hypnotized for pain, and I have myself, and I've been taught self-hypnosis. I've been hypnotized where I can make my hand entirely numb. So if somebody wanted to put a needle in my hand for whatever reason to do an IV, I could make my hand numb. There are means by which hypnosis will be more successful than others, one of which is smoking cessation. So if you're trying to quit smoking, the whole technique of hypnosis is to make yourself imagine that you're getting physically sick, and it's a very visual type of process. But with hypnosis, while you're highly suggestible during that time, you imagine yourself getting extremely sick while you're smoking. So you actually imagine the cigarette smoke going down to your lungs, what the tar is looking like, that you're coughing up all this black junk that's just totally disgusting and makes you want to vomit. In other words, what hypnosis is doing is making you feel physically sick even at the thought of smoking. So hypnosis is best for helping you quit doing things. Is it so good at helping you decrease your appetite? That's been debated for decades now. And quite frankly, I haven't seen people get a lot of success decreasing their appetite, because you still got to eat. But I have seen people have really good success with things that they have to totally quit, and smoking is a good example of that. But I think the key with hypnosis is, if you're going to do it for the new year, just to make sure that you get some training techniques so you can practice it again and again and again on yourself, and you certainly can. When I first started doing television, 27, 28 years ago, I was terrified, thinking about talking to people on live television. I didn't know what I was going to say, so I was terrified. So I did actually do some self-hypnosis before I went on the air a long time ago to get myself to relax and just allow me to focus. But now, I have to drink caffeinated beverages to keep me awake in the evening because I'm so relaxed out here. So over the course of time, with practice, you'll find that you're going to be able to do the hypnosis better and better. Thanks for your call. Let's go to our next email. Our next email reads, Dear Dr. Falver, can the flu or common cold lead to depression or other mental health issues? My friend had a cold last week and is better, but still seems really down and not herself. You bet it can. The flu and the common cold will release inflammatory proteins called interferon proteins, and these proteins go to the brain and can make you mentally depressed. They can cause you to not care about things, not enjoy things, lose your motivation, decrease energy. They can cause you to ache all over. Ever notice when you have the flu, you ache all over? That's these inflammatory proteins being released. And when the inflammatory proteins are being released, it can make you feel physically and mentally depressed. So yeah, the cold, the flu can make you feel that way. And some of the treatments that have been under development for the treatment of depression have been ones that attack these inflammatory proteins. Interleukin-6 that's the inflammatory protein I was trying to remember. Interleukin-6 is the main inflammatory protein that seems to be released when somebody has a cold or they have the flu. And interleukin-6 with certain types of depression seems to be elevated, and it's been debated for the past 10 years. Should people with depression take an anti-inflammatory medication like an NSAID, such as Motrin or Advil, Mobic? Should they take automatically an NSAID to decrease inflammation? And that's never been established that really works that well. But there's something about inflammation that will cause some people to have more difficulty, especially if they have the flu, the cold, or a depression. But if you have that inflammatory process going on, the symptoms of inflammation in your body will be sadness, fatigue, lack of enjoyment with things, difficulty with sleep, body aches. Those are all symptoms of inflammation, and they're due to interleukin type 6. Thanks for your email. Let's go to our next caller. Hello, Teresa. Welcome to Matters of Mind. Teresa, you want to know, is it possible to develop schizophrenia past your 30s? It's possible, but not likely, Teresa. Typically, schizophrenia is a condition that does indeed develop to some degree in the womb. And then what happens, you go through your early childhood development years, and stuff happens that will flip the switches for the schizophrenia to emerge. And that's why many people, even though they have the genetic propensity to develop schizophrenia, they don't, because they haven't had the environmental triggers for it to develop. If you have a parent with schizophrenia, one parent with schizophrenia, your likelihood of having schizophrenia yourself would be around 8 to 10%. But that also gives you a 92 to 90% likelihood of not having schizophrenia. So there's a lot of environmental factors associated with schizophrenia. Early in your adolescent years, if you're socially awkward, if you have a lot of social anxiety, if you hear things kind of in the background that aren't there, if you're having trouble academically, socially, and then lo and behold, you start using marijuana as a means of treating some of these symptoms, those can all be triggers for schizophrenia usually. On the average, it develops when you're 16 years of age as a woman and 24 years of age. I'm taking it other way around. 16 years of age as a man, 24 years of age as a woman. It seems like estrogen protects women from getting schizophrenia till a little bit later. But on the average age, about 24 years of age. After 30, yeah, but I would have bet if somebody developed clear-cut schizophrenia after the age of 30 years of age, they did have some so-called premorbid symptoms early on. In other words, they would have had some oddities in their thinking. They would have had a lot of social anxiety. They would have had difficulty with processing information. They might have been diagnosed at one point with attention deficit disorder or even autism. Some of those signs would have been there to some degree already and might not have been highly recognized until after 30, but usually on the average, for men, the average age of onset of schizophrenia is 16. For women, it's 24. Thanks for your call. Let's go to our next caller. Hello, Cassie. Welcome to Matters of Mind. Cassie, you want to know, is it okay to take over-the-counter antihistamines to treat anxiety? And how does antihistamine affect anxiety? I don't highly recommend taking antihistamines for anxiety, Cassie, because here's the reason. Because basically an antihistamine is blocking histamine. Histamine is what we use to stay awake, all right? So you and I, if you're paying attention to me right now, histamine in your brain is sky high. As my histamine is sky high, histamine keeps us awake. So in my mind, I wouldn't want to take a medication that intentionally makes me sleepy during the day, and that's what antihistamines do. They kind of chill you out, they block histamine, they make you a little bit tired, and they decrease anxiety. I'd rather kind of go after the specific neurochemistry that's affecting anxiety, such as norepinephrine, serotonin, GABA, gamma-aminobutyric acid, glutamate. These are all neurochemicals that are specifically causing the anxiety itself, and I'd rather see that aspect of the anxiety be addressed. But basically, antihistamines Yep, over the counter, they're going to make you tired, and they'll chill you out, but your primary care clinician has a lot of better ideas on how best to get a hold of that anxiety, especially understanding what's causing the anxiety. I mean, there might be various causes for the anxiety that need to be addressed, and that's always the best way to get past it. Some people will take, as we talked about earlier, a short-term medication for sleep to help them get through a rough patch, but at the same time, that probably needs to be short-term, because if you use antihistamine medications long-term, sometimes it could just make you kind of tired and not care. So we don't usually recommend those long-term. Thanks for your call. Unfortunately, I'm out of time for this evening. If you have any questions concerning mental health issues, feel free to email me here at mattersofthemind@wfwa.org, and I'll see if I can get to your email during the next episode. God willing and PBS willing, I'll be back next week. I'm Jay Falver, and you've been watching Matters of the Mind on PBS Fort Wayne. Good night.
Preceding program on PBS Fort Wayne was made possible in part by
Cameron Psychiatry, providing counseling and care for those that may struggle with emotional and behavioral challenges. More information available at CameronMCH.com.